Hello, this is Dr. David Wilkinson, and in this short video I'm going to answer a question that I'm commonly asked with regard to parathyroid surgery. Now, this is an example, or this is an anatomical illustration. You'll see one very much like this when you come in to see me and we're discussing the surgical options. But people often want to know when they're having parathyroid surgery, will I be looking at all 4 glands? And this is an area of controversy, I suppose, because some people feel very strongly that we should look at all of the parathyroid glands. Other people say we should only meddle with the one that's causing trouble. And of course, there are some situations where you want to look at all of them and some where you only want to look at one. We know that 90% of people with an overactive parathyroid gland have just one abnormal gland and the other 3 are normal. But the other 10% will have a varying number of involved glands. It might be 2 or 3 or even 4. And obviously in those patients, if we only take out the one gland that we knew was abnormal and we leave another abnormal gland still in the neck, then the problem of an overactive parathyroid with high blood calcium levels won't be cured, and we'll need a second operation to deal with it. And that's why people say, well, why don't you just look at them all while you're in there? Well, when we develop in the embryo, as an embryo, the parathyroid glands start higher in the neck and they descend to their position near the thyroid. This illustration shows the neck anatomy behind a layer of muscle which is at the front. Once we come behind that muscle, the key structure here is the thyroid gland, which is this butterfly-shaped structure sitting just below the voice box and in front of the windpipe or trachea. In actual fact, it folds into this crevice lying between the trachea and the main blood vessels that go up to the head. The parathyroid glands are behind the thyroid. This illustration shows what we would see if we could get inside and look at the back of the thyroid. So here we're seeing the back of the swallow tube, the esophagus, and the back parts of the thyroid sitting here against it. And we see the parathyroid glands here quite clearly. There, and there. So they just look like small, yellow, fatty blobs, really. And they're a lot harder to see than what you see in this illustration. So all the spaces in here are filled with other little tiny blood vessels, connective tissue, fat, and not only that, but the parathyroid glands are not always in this position because, as I explained, they move to that position when you're developing as a baby. So some of them don't go far enough and they're stuck up here. Others go too far, they're way down there, or they could be out to the side, further in, or even hidden within the thyroid. The thyroid has an uneven surface and these little glands can hide in those crevices. So parathyroid glands can be very hard to find. That's why we do the special tests to try to locate where your abnormal parathyroid gland is. Those tests don't show us normal parathyroid glands, they only show us overactive ones. If it shows us which of your glands is overactive, then we can focus on that one. If the tests don't show any glands at all, then there's a higher chance that you have more than one abnormal gland. And of course, in that situation, we would have to look at all 4 because we don't have a clue from the tests which of the glands is going to be abnormal, and we know you've got a higher likelihood of having more than one big gland, so we need to look at them all. But if, on the other hand, your localization studies, as we call them, have identified which of these glands seems to be the abnormal one, and is it in a common location or an uncommon location, in order to assist me when I'm looking for it. If the scans show us which gland it is, and I only focus on that one and remove it, the cure rate is very high. Particularly if we have 2 scans that agree with each other, then the cure rate is more than 97%. And the advantage of just looking for that one gland is that the rest of the anatomy is not disturbed. When we do surgery, the tissue that's been disturbed falls back into place and heals with scar tissue, so it's difficult to re-enter that area. So let's say that we decided to look at all 4 glands. For one thing, we might not be able to find all 4 glands because normal parathyroid glands are very small and can be very well hidden. So it might require a very extensive dissection just to prove that the other 3 glands are normal. What if we made a mistake during that dissection? In actual fact, you did have 2 abnormal glands. I found one big one. I looked hard for the others but only found 2 others and they were normal, and the 4th one was missing. And then I might say, well, we've been looking long enough, I'm not doing any more surgery, I might do more harm than good. Then after the operation, when we check the calcium level, if there was a second big gland there that I didn't find, it's the missing one. Now we know you're not cured because the calcium level didn't go down, and we're saying, well, we have to go back and find that other one. Is it going to be easy to find? No, it'll be very difficult because now the whole area has been dissected out, scar tissue has formed around it, and this missing gland is going to be difficult to find, and there's a risk of injury to important structures while we're in there, such as the nerve to the voice box. And if that nerve is injured, then you can have a permanent hoarse voice. An injury to that nerve at a first-time parathyroid operation, before any scar tissue forms, would be very rare indeed. So that's why I say if your scans show a definite gland, we just aim for that one. The cure rate would be very high, and if on the very small chance that there is a second big gland there, it's going to be in a position where we can go back and find it very safely because the tissue hasn't all been disturbed and we don't have a lot of scarring that's going to put the nerve at risk. So I hope that helps to explain why in some cases we just look for one gland, and in other cases it's better to look for all 4 of them.